Hi, everybody, and welcome Anita into Boob Camp. Well, this is the boob room setting that we've got going on here because you know that we love to educate and inform women in Boob Camp about their health. And we were talking, you're part of my PPP program, my preferred partner program, and you were
Yeah.
like, Chelsea, stop talking for once and let me share my story. And your story was that amazing that we can't keep it to ourselves. I am
Mhm.
so proud of you. And thank you so much for being brave enough to share. I think you are like me, and we're going to hear a lot more. Like, you're happy to speak out and you're going to
Yeah.
help educate and join our mission of reaching 5 million women. So, thank you, Anita, for joining us today.
No, no worries. It's cool.
Okay.
Fun.
Fun. It is. And I know because I've been a therapist, like you're seeing bodies. You've got hands-on bodies most of
Yes.
the week. Okay. So you're seeing
All week.
patients all week. Yeah.
Yeah.
And I was there too. And I know how much of a toll it can take on your body, and emotionally as
Hmm.
well. So especially if your body is aching and in pain, how do you help somebody else? So let's start with, do you want to share your story about how much trauma
Yeah,
that you've been in?
absolutely. So I was first started having pain. Well, I had my first injury when I was 18. I was an outdoor ed instructor, starting off with that. And I did a 3-month canoe trip across Canada. And then I was leading a canoeing group and I pushed a slightly overloaded canoe into the water and it got stuck in the mud. My body kept going, but my back didn't. And so when I was 18, I had my first back injury, which was misdiagnosed. I was treated by physios, chiropractors, osteos, acupuncturists, and everyone was like, yes, we can cure you. And so I had back then hamstring pain and glute pain, but no back pain. And so no one ever looked at me as as a whole person. They only ever looked at the point of pain. And that continued on until I was 27. And I just got used to the fact that I couldn't step forward with my left leg.
Can I
And
just ask in here in the group, does anybody else feel the same? Does anybody else feel that they've never been listened to and treated as a whole person? Yeah. Yeah, a couple of hands up, Anita. So there's people that
yeah,
can are feeling your pain. Yeah.
yeah, and that's the story I get in my room all day. That's the people that come into my room every day crying because I'm the first person that listens to their whole body.
Yeah.
And so I went for 5 years, going to physios and like, oh, just do this exercise and you'll get better. Just do this and you'll get better. Just keep coming back 3 times a week and you'll get better. I spent a fortune, just getting better. And I'd walk out the door and feel no different. Um, and then one day I was like, this is ridiculous. I can't keep doing my job. I can't keep walking where I step forward with my right leg and drag my left leg to keep up, leading hikes up and down mountains, doing vertical rescues, deep water rescues. I can't keep doing this. So I was like, I need a new career. And because I have a brain that is constantly asking, but why? But why do I still hurt? I tossed up between finishing my psychology degree, which I started in Canada, or doing a hands-on approach to healing. And I was like, well, I'm a hands-on person. Let's head that direction. And I was like, physiotherapy hasn't helped me, chiropractic hasn't helped me, osteo hasn't helped me. Let's try remedial massage.
Hmm.
So I headed down the path of remedial massage. And even then, I still wasn't getting help, even in my training. Like, there was a massive gap in my training, and I had no idea what it was. Like, I did everything, I was doing all the upskilling, was getting towards the end of my diploma, and we hit lymphatics. And they're like, we're just going to spend half a day on lymphatics because it's really boring and it's not really of any benefit. And if you're interested in it, go study it later and then charge twice the amount for it so no one wants it.
Hmm.
And I was like,
Yeah. Same
oh,
as my
okay,
training.
not important. Won't worry about it.
Mm.
So I got my diploma and I was treating for about 2 years. And I was back to but why aren't we making a difference? Why is nothing changing? Why are people still coming back in pain?
Every
Um,
week, the
every
same.
week. Every
Hmm.
week the same, no change, no difference, like some muscular skeletal improvement, some acute improvement, but for the chronic people, there was nothing. There was no change. So I moved from where I was working into a new place. It was a beauty place. Still as a remedial massage, I just decided to go out on my own and was renting a room for them. And they're like, "Oh, how would you feel about treating our tattoo removals?" And I was like, "Oh yeah." So I researched, well, how do you remove tattoos through massage? And it was like lymphatic treatments. I was like, interesting,
Mm.
interesting. And like a little light bulb turned on. So I did the rhythm massage Michelle Vasello course,
Hmm.
knocked it over in a weekend, and just like everything fell into place for me in my head. I was like, oh, that's what I've been missing.
Yeah,
So
just that
from
little
that,
half an hour of training,
yeah,
just that 15 liters of fluid, just where all your cells sit.
absolutely. Like how you clean your cells, what keeps the fluid moving, what stops you from dying, basically. And I was like,
Yeah.
hang on, this is such an essential part of the body. Why was this the one thing I was told to ignore?
Mm. Yeah. And so leading up to now, all the itises that you've had, like all of
Yeah.
the
So
fibromyalgia, all the chronic everything. So
so I've got chronic pain, chronic pelvic pain, hypermobility, Ehlers-Danlos syndrome, fibromyalgia, chronic fatigue syndrome, um, hyperfocus disorder, sensory disorders. I've got all of the disorders. Every doctor's gone, don't know what to do for you. Learn to live with it. You're in pain. You have complex PTSD. You've got autism. This is just you. Learn to live with it. You get you get fibroids in your uterus. You have vaginal pain. Just get used to it. Your bladder keeps you awake all night. Just get used to it. Nothing we can do for you. And so that's been my last 3 years with the medical field. I've been in
were they prescribing any drugs for you for all of
so
these
many.
things?
So many drugs. Like I've been on every drug. I can no longer take any pain medication because my body resists them all and I have an allergic reaction. I can't take any antidepressants. My body rejects them and I have an allergic reaction, and it increases suicidology.
Okay, so your body is telling you that's not going to work for me, Anita.
No, it,
That's
it
not
doesn't
going to
work.
work.
No.
Mm.
So every medication pretty well lasts 6 months, and then I either have an allergic reaction or it does the exact opposite response to what it's supposed to do.
Mm.
And I was putting on massive amounts of weight. Like I probably put on close to 10 kilos in 6 months.
Okay. Okay.
And then everything started to hurt all the time. Like I
Mm.
would have like a week at a time where I couldn't get out of bed. And this is just last week, and my fingers would just look like sausages and I could hardly move my hands. And so I
Yeah.
couldn't work.
Yeah.
And I'd go to the doctor and she'd be like, oh, here's a different tablet, try this one instead.
Mm.
And I have a lovely doctor. Like she's constantly thinking, she's constantly calling me, hey, Nita, how are you doing? We haven't tried this. Let's try this.
I hear
Um,
that from so many people. Oh, but my doctor's so lovely.
yes. Anyway, so I was just thinking about it, and like after a few months back, I went back to my pain specialist, and I'm like, you've got to do something. There has to be something. And he's like, no, you need to learn to live with it. It's like you need to go have a fusion on your lower back, and there's no point because you got too much arthritis. Your sacrum's got arthritis in it. Probably going to make it worse. You have fibromyalgia. You're not a good candidate for surgery.
But the
And
problem here, Anita, the problem is here
yeah,
is that so many women would have gone, okay, I'll go and have my back fused.
yeah,
Okay, I'll take more of those drugs.
yeah,
Okay, I'll do whatever you tell me to do. Okay,
yeah. I'll go get
okay,
my uterus removed.
I'll get my uterus, yeah, because you've got a white coat on, and
Yeah.
I've been brought up to believe that you know best.
Mm. So like, after that final conversation, I was on a holiday and I was just discouraged. And I was like, well, I can't keep living like this. This is miserable. I'm in hell. And then I was like, hang on, let's just stop, step back, and think for a minute. What is the common denominator with all of my medical conditions? It's inflammation. Where does inflammation come from? The lymphatic system. What is the one system in my body that hasn't been treated, that no one's looked at, that no one has investigated, that no one has tested? Is my lymphatic system and my endocrine system. Those
Hmm.
two are linked together. If
Hmm.
one isn't working, the other isn't working. What do I
Hmm.
not have? I don't have a thyroid.
Okay. When did that happen?
That came out last year. It grew two tumors in it.
Okay.
Yeah. And after that, that is when everything started peaking, when my
Mm.
thyroid came out.
Because you're
So you
poison.
can just see the scar there.
Yeah.
So that was after that that things actually started getting drastically worse because the medications I was on was stopping the thyroxine from working.
Okay.
Um, so I was just like, I went back to basics. I was like, what have I studied? What have I learned? What has not been done? I was like, nothing has been done about my lymphatic system, which has been clogged up because of all of the drugs, because of all of the surgeries. Last year, I had two surgeries in 2 weeks.
Yeah.
So
Lots
I
of
had,
scarring, lots of trauma.
yeah, absolutely. So, endometriosis and thyroid removed 2 weeks apart.
Yeah.
And what no one tells you is about the post-surgery depression
Mm.
that you get about 2 to 3 months after a surgery.
Because you're still in the same spot.
Yeah, yeah. So I went back to everything I've studied in the past, everything I've wanted to get my clinic to in the past, and it was about, well, we're about chronic pain. We're about chronic conditions. And the one system that no one looks at when it comes to anything chronic is the lymphatic system
Mm.
and the endocrine system. And if the endocrine system doesn't work, it turns your lymphatic acidic. If your lymphatic system is acidic, it breaks down your lymphatic vessels. If your lymphatic vessels break down, you start holding fluid. And if you're women, that's in your abdomen and your thighs, which then people will tell you you're fat and you need to exercise more. And then you get depressed because no amount of exercising is making a scrap of difference, which
Because your
then creates,
thyroid's wrecked. Yes.
yes, which then creates a negative feedback loop, increases the depression, increases the acidity, increases the weight gain.
Yeah. Yeah.
Um,
Does
so
everybody understand that loop? Yeah.
yeah, which then increases the pain because if you have the fluid, you have pain. So if
Yes.
you study the Noin pain group, like if you ever done their study, it's like that whole loop. That pain is caused by pressure, chemical, and heat. What controls those three things is your lymphatic system.
Mm.
So if your
Yeah.
lymphatic system isn't working properly, it's sending signals to your brain saying that you're in pain. If your brain believes you're in pain, it's going to send more fluid to the area. More fluid to the area is going to increase the pain.
Yeah. Putting out the fire.
Yeah.
Yeah.
So if we can stop the fluid or if we can keep the fluid circling faster, we're going to reduce the pain.
Mm. And there is only so much that your lymph nodes can handle as
Yes.
well. So you've been under so much stress. So the cortisol, all the different hormonal issues that's going on,
Yeah.
all the different chemicals, so all the pharmaceuticals, all the surgeries that you've had, there it's been inundated. So your lymphatic system is now like a sludgy, gunky dam
Oh,
instead
it's
of
disgusting. Like
yes,
if I have a lymphatic massage, I got a lymph node in the back here that swells up to the size of a golf ball.
yeah,
When I do the lymphatic brushing daily, all of these lymph nodes in here just swell up.
yeah.
And it's
Okay,
not
so
because I'm sick.
talk us through what you did. So you found me, you found the gloves.
Well, I found the gloves. I started doing it religiously daily. So the dry brushing for a minute before I got in the shower.
Hmm.
And so before this, if I was in an air conditioned room, um, cold air was like sharp knives stabbing into me. Hot air made me nauseous, but I never felt hot or cold. But my fingertips were turning blue.
Like, how can you be happy ever when you've got even air conditioning against you?
Yeah, it was driving me crazy. I'm trying to treat people and having to turn the air conditioner on and off to either not feel nauseous or not be in agony.
You're doing your hot and cold lymphatics.
Yeah, basically. Poor
Yeah.
clients on the table, like 1 minute they're freezing and the next minute they're like, uh,
Yes.
so I was just like, no, there has to be more of an answer. There has to be more I can do lymphatics, hence finding you and working with the gloves. And so After my last, I just like lost it. I was like, this is ridiculous. I can't even be in an air-conditioned room or a non-air-conditioned room without either feeling sick or like I've been stabbed with sharp knives. I
Mm.
was like, all right, I'm going to be religious with the gloves. The first night I did the gloves, I woke up the next morning and was able to get out of bed without pain, which was the first time I'd gotten out of bed without pain in probably 4 years.
How
Um,
unbelievable is that? Like, you're giving me goosebumps. Like, I am literally covered in
yeah.
goosebumps right now.
And that was just one session. One session just got rid of all of that tension around the nervous system so that I could move properly.
Wow.
Um, the other side to that was that for the first time, like I did it and I had hyper energy that evening and I struggled to sleep because my body was like, ah, we're out of pain. So I actually need to do it in the mornings to give me that energy rather than in the evening.
Hmm.
So I did it every day for a week, which was you were like, oh, do it, every other day when you start. I was like, it's completely OCD. Like, no, we're going to do it every day because I'm not in pain. So I did it for 2 weeks like that, and then all of these lymph nodes under here just swelled up massively, and I'm like, wow, this is really, really powerful.
Yeah.
Might need to tone it back a bit.
Yeah.
Um,
Because you're pushing all of the fluid, okay, to
yeah,
those T cells, the B cells in that live into your lymph nodes. And
mm,
but they need a little bit of time to process.
yeah. So I cut back a bit, but the annoying thing was that when I cut back a bit, the pain came back.
Yeah.
So for me and for I think a lot of chronic people, and what I'm explaining to all of my chronic clients is that this isn't something where a one treatment is going to fix you. It's not going to be a cure, but it's going to maintain you. It's going to stop you from getting worse. It's going to help you get through every day.
Is that
Um,
when you bought in the compression?
so I bought in the compression after my first back surgery.
Okay.
Um, so that was in 2017.
Hmm.
That's so I had nerve pain down my left leg for 5 years. I couldn't use it by the end. By the time the disc finally completely exploded, and everyone goes, "Oh, it wasn't piriformitis. Oh, it wasn't SIJ syndrome. Oh, it wasn't a hamstring tear. Oh, you had a disc bulging. We didn't know." And I was like, "Oh." So they when I went to hospital and I was waiting for surgery, they put compression on my legs, and for the first time in 5 years, I didn't have leg pain.
Yes.
And I was like, right, I'll just take these home and I'll skip the surgery.
Yes.
And they're like, no, we actually need to get rid of the disc. But the surgeon botched it and I had to go get it done again. But that was when I was like, okay, I need to study compression therapy. I need to understand what it did that made the nerve stop hurting.
Mm. Yeah.
Um, so yeah, I bought my first set of compression
Mm.
boots. I actually bought the whole kit from Normatec to start with immediately.
Yeah, me too. Yeah.
And had that running. And I was still like, look, these are good, but they're not great.
Yeah.
But they're
Yeah.
doing the job, but there's got to be more, there's got to be better, there's got to be something different, there's got to be something more holistic. I mean,
Mm.
their thing is just about recovery. Just put the boots on for recovery. And I was like, but that's not actually how the lymphatic system works.
You know how hard it is, Anita, for people to be telling, oh yeah, I've got a Normatec. I'm like, okay, have they? Well, when Normatec was first out in Australia, I would send out. I partnered with them to send out. This is the information. Start with the gloves because I didn't have my own range of compression then.
Mm,
Start with the gloves and make sure you pop the cork first, it'll activate all the lymph nodes, and then treat yourself like it's a tube of toothpaste and squeeze from the bottom
yeah,
once you've opened up all the areas. They've got zero education on that. Drove me
no,
insane, especially when Hyperice bought them out. And then they didn't care again. They stopped sending out any of my information, and then their machines started to break. So mine that I was buying for my clinics wouldn't even last 12 months.
yeah, well, and that was the frustrating thing because, like, I've got so many clients who go, oh, yeah, they've got them at my gym. I'll just stick it on my legs after a gym session. I'm like, but what about the rest of you? They're like, what do you
Yes.
mean about the rest of me? And I'm like, well, your lymphatic system, if you just squeeze everything up to your groin, what happens to it then? They're
Yes,
like, what?
exactly.
So, what
What?
I've been doing for the last 4 years with treatments is opening sequence lymphatic and then being like, all right, we'll put the legs on you while I'm doing the opening sequence for lymphatic, get everything moving, and then we'll do remedial on the back at the end.
Yes, perfect. So
And
I'd
that's
like to
how,
know, yeah,
yeah.
I'd like to know, when did you realize that starting massage with your head face down in a hole was wrong?
Well, the minute I laid down in a hole and got stuffy sinuses.
Hello.
Yeah.
We're all still laying down because our massage therapist tells us, lay down, put your head in the hole.
Well, when
And
I was studying massage, I actually got in trouble one day by one of the instructors because I started my treatment face up. And they're like, why are you treating face up? And I'm like, well, the issue with this client is they've got a sore back. They've got a sore back because their pecs are too tight. So if I can release their pecs first, then the back muscles will relax. Oh,
yes,
no, you always got to start face down. I was like, but why?
did they
Why do
answer
I need
why?
to? Yeah, but why? I bet people hate that question.
Yeah,
And
did
then,
they
but
answer
why
you?
was because it's less awkward. They're not
Yes.
looking at you. And I'm like, what? They can close their eyes.
Because
Like,
then they don't have to talk to you. Then they can not have, they might be shy. They don't have to converse with
yes.
you. So let's
Like, and
whack
they're
their
like,
head in a hole and fill their
yeah.
head with snot and don't activate their lymphatic system at all and just fill their body up so it's puffier and get and clogs up more. Let's just do that.
And then creates more back pain. And then they walk out looking even worse than when they came in.
Yeah. And I've got a and you got a floor full of snot. That the
Yeah.
nose has just dripped down.
And can I add something very Hello, Miss Sarah. Hello. And can I add something that I believe they treat everyone the same way to make a quick buck out of it, and they don't treat each patient individually. So they don't
Yes.
consider that they're individuals with different needs. So sometimes someone would need to be in front and another person that needs to be at the back. So they don't take individuality in
Well,
consideration in
well,
most cases, I believe.
well, sort of.
So
But we don't either. So as a lymphatic massage therapist, we are going to start everybody in the chest first
Yes.
and feel where they are blocked, how long we need to stay in this chest area, and then in the stomach area before we even touch their sore knee or their sore toe, or the reason that they came in for the first place. So we are following our own steps, but still customizing it to what we feel, not to the words that come out really. We go by what we see and what we feel on their body.
Yeah, and the longer you do it for, like, I get people coming in going, oh, my calves, they're so tight. I stretch them so much and they don't doesn't make any difference. And I'm like, oh, okay, well, let's have a look. You just kind of gently press it and you just like, okay, well, do you see how my fingers are just sinking in there? Like, oh yeah. And like if I just do a ripple test, do you see how the fluid's just moving? And like, yes. And I said, there's nothing wrong with your muscles.
Yeah.
Muscles are fine. You're just full
Yeah.
of fluid. And they're
Yes.
like, oh, well, what does that mean? I'm like, well, it means we're going to do a lymphatic drain. Like, well, but I
Yes.
really want you to get into the muscles. I'm like, well, I can if that's really what you want, but you're not going to feel better for it.
Because it's no pain, no gain, Anita. Like I've
The
been
muscle
the
doesn't
biggest.
hurt, but there's,
Oh,
yeah,
I was called Cruella. Like I had the nastiest names of because I used to bash men up. And my body would be so sore. I'd do all this deep tissue stuff. I'm like, what am I? And then I discovered the whole lymphatic thing, and it's like, oh, this is easy. I,
yes, and they're not coming back as frequently.
well, I don't want a patient every week. I want them to
No,
come weekly for a couple of weeks, and then fortnightly, and then come and see me once a month.
yeah, then
You
I
know?
want them to buy a compression kit and try look after themselves at home.
Yes. Yeah. So, and that's the thing is I don't want to see a patient who is not going to look after themselves at home, who's not going to put some effort in and who's not going to go through the detox process and who isn't going to feel and like who just said, oh, just give me a pill and I don't want it to hurt. And this whole pussy society is, yeah,
Mm.
there's my bit of a rant for today. But if you've done the, if you know, if you've done the crime, if you've poisoned your body, if you've done some things to it along the way, you can even have toxins from being born. Babies are born with over 300 different heavy metals in them these days. So you might not even have picked them up from your life. It can be detoxing from being born, from your mum and from your dad, even. So you have to be able to let all of that go. So then, and then put the new in. And that's really hard in today's day and age with all the toxins in everything. And now you don't even have a thyroid to, help with that. So tell us the
Yeah.
story. So you started day one you could get out of bed. Day one
Yeah,
after
day
using the
one, I
gloves.
got out of pain. My skin didn't hurt. It didn't hurt to brush up against things. The air conditioner wasn't causing me pain. I actually had energy, and it was just a whole new perspective. I was like, okay, now I need to get this out to my clients. And so since then, we sell about 3 gloves a day.
Yeah, 3 sets of gloves a day to all of your patients. And I'm sure they're coming back and getting some for their friends and telling
Yeah,
telling their
yeah.
people. So
So
you're seeing
we,
mainly chronic pain people, Anita?
yeah, so chronic pain is out in Bundaberg. There is nothing here for chronic pain. There is nothing here for any form of chronic anything. I've got doctors sending patients here now because they're like, we don't know. She does lymphatic stuff. She might have an idea. And I'm like, well, you're a doctor. Shouldn't you understand the lymphatic system? Oh, yeah, we just tried a fluid pill. That's like the exact opposite of what needs to happen.
Yes.
So yeah, we're now getting referrals from doctors. Um,
Beautiful. Well
being
done.
like, yeah, go see her. It'll take you about a month to get in, but go try.
How does
Um,
this feel for you, Anita, to be able to experience like all of this and now to be able to help others?
well, it makes my experience validating. I mean,
Mm,
like I've lived through hell for the last 10 years.
mm.
And it's like, it's not, I don't want to be like, oh, well, at least there was a reason for it, because there is no excuse for having been let down so poorly by the medical system and for no one to having say, hey, stop. Have you thought about the one thing that connects all of your systems together? And that's the lymphatic system. Have you thought about looking after that? You know, I had to come to that conclusion on my own.
Yeah.
And that just actually makes me angry.
Yeah.
And the
Makes
reason
me
for that
angry.
is because the pharmaceutical companies don't have a tablet for the lymphatic system. So
That's right.
there's nothing for that other than you actually have to do something about it yourself. You have
Mm,
to take a proactive stance, which is what, the education that I give my clients on the table.
mm.
And, like most of them end up buying a set of gloves. Pretty much every treatment gets upgraded to a compression treatment at the end, or a series of compression or a massage compression package. We probably earn about $15,000 per week just on the compression aside.
So good.
Yeah.
Yeah. So you're
Um,
using my CJ and Co circulate compression?
yeah. Yeah, I'm
Yeah.
using those. They're pretty well running hot all day. I hire someone just to do that.
Yes.
And we now started doing home visits with them, so taking them to people who can't come to us.
Oh,
So that's been really good. We're looking at how do we rent them to people who are an hour or 2 hours away. We get people an hour or 2 hours away for treatments, because there's nothing else near here.
yeah.
And they're like, we want to try it consistently to see if it works. How do we do that without having to drive in an hour every day? Which is why I have to keep ordering stuff from you, because I'm like, we need more because we're renting it out now.
Yeah.
Um, so,
Yeah,
people,
it's pretty cool from where I sit to see the growth that
yeah,
we've had. And thank you for sharing your clinic experience because I don't get to experience that anymore. Since closing my clinic, like it broke my heart, but it was
mm,
something that I had to do because how I get to coach you and I get to coach other therapists on how to be the best therapist and how to do the Chelsea Gene lymphatic massage and what to incorporate. And that's how we reach our goal of reaching 5 million women. And as you said, you're not in a little town like Bundaberg. Like it's quite big.
it's a
It's
city.
it's a city. Yeah.
Yeah.
And there is nowhere else to go for pain. Like I don't want anyone to have pain, but like thank you for giving some people somewhere to go. So you're putting on extra staff to help.
Yeah, so I've put on one extra staff member. She's casual at the moment, but she'll be full-time next year. I'm looking for another little ad out here. Anyone who wants to do full-time work and wants to move to Bundaberg, there's a job opportunity here who's got the experience in lymphatics and remedials or something.
Hmm.
Because I'm working 6 days a week, 8 people a day.
Yeah.
Um, that's not sustainable for much longer. I have another part-time clinician who does 3 days a week. Next year, I've been doing a lot of research on the light therapies.
Hmm.
And I'm like, the next step for me is I've been given 7 different diagnoses for sleep disorders. And I'm like, well, how do you treat sleep disorders? Tablets don't work, they just make it worse, and that's through light therapy.
Yeah.
Um, and half my clients all have sleep disorders as well. Chronic pain equals a sleep disorder increases chronic pain increases fluid. There we have another negative feedback loop. How do we
Our
break that?
glymphatic, yes, all of our glymphatic drainage that
Yeah.
needs to happen. Yes.
Yeah. So next year we're bringing in light therapies.
Oh, you
Um,
might get a pod.
that's what we're thinking.
Ooh,
Yeah.
yes. Get a
Yeah.
rejuvenist.
Yeah. So yeah, well that's all of that's next year's future Anita's problem. That's next year.
Yeah.
Um,
Yeah. But Anita is now being able to think clearer,
yes.
being able to enjoy. So, are you doing anything for fun now on that half a day off that you have?
Um,
Is there something that you can do for you? Because a lymphatic issue is connected to a disconnection with joy, not having enough fun. So,
yeah, so what I used to be was, and I can show you, is I used to be an artist. So I don't know if you can see that there.
yes, I can, two parrots,
Yeah.
two
So
beautiful green parrots.
before the brain fog hit in, and before all the trauma kicked in, I was a fine art artist, so pastels in specific.
Yes.
And then once the brain fog started, once everything started in my head to deteriorate, couldn't think, couldn't see properly, lost my fine motor skills for getting the perfect precision lines I was after.
Hmm.
I've been able to start redoing my art
Oh, beautiful.
because I can now see colors properly.
Oh, oh yeah, so many things. What has
Yeah.
family and friends had to say? Have they noticed a difference too?
Um, yes, there has been definitely a notice in, oh, you look brighter, you're more cheerful, you don't spend your entire day off in bed. They're like, Anita, you got too much energy, you're working too many hours. How about taking 2 days off? I'm like, no, no, I like working.
Yes. It's
Um,
addictive, isn't it?
it is, and particularly when you finally found that thing that's been missing.
Yeah.
And it's
Yeah.
like, well, now I'm making real change. I'm making permanent change. It's up to my clients whether or not they take it home and do it.
Mm.
But, step one is the education.
Ladies, is there any questions that you'd like to ask? Just pop them in the chat box before we're finishing up because I know Anita has to get back to her clients today. But yeah, making that difference, Anita, isn't it? It just
Yeah.
brings you back up. Yeah. But you also have to be careful not to take too much on. And
Oh, yeah.
yes,
That's why I hired a second brain.
good. Good. That's me too. That's why I've got this brain sitting here, and then there's another one in Zoom. Mads is in Zoom, and then there's another 10 or so around the place now. So we can keep this movement going. So we don't have to slow down. So we can keep knocking on doors and causing a little bit of chaos and a little bit of uproar. And hopefully GPs will all come on board, and then the breast cancer nurses will come on board, and then we won't be this seen as this rival or this, whatever that I'm painted at now, like the lymphedema and lipedema and all of those associations don't
Mm.
want anything to do with me because I make it so easy to do.
Well, I've been treating scars and wounds for years. And I had one client who just had a tummy tuck done.
Yeah.
And she was like, when do I come back to you? I was like, as soon as you can get in a car and get here. As
Yes.
soon as you can get someone to get you to me, you be here. And
Yes.
so she found someone who could get me here the day after her surgery.
Beautiful. Straight
And
away.
she told her doctor, I'm going to Anita for a lymphatic drain. And he was like, oh, I wouldn't recommend having anyone stick needles in you.
Okay. So he
And
meant,
then she was like, no, no, it's a massage. And he's like, oh, well, if you believe in that woo-woo crap, go for it. But, it's not going to do you any good.
yes. Yes. Well, let them. Okay, we're here, we're shining our light, we're doing the best that we can, and we've got advocates in here as well. These ladies willing to join and listen to our story, others joining on Boob Camp Live. Like I'm getting 100,000 women to my website every month now, wanting to know all and learn about lymphatics. 26,000 women now in our Boob Camp group. It is so hopefully, Anita, that you can jump in there and share, keep on sharing. I'd love to hear more stories about you and about your clients because, ladies in Zoom, has this motivated you to use your gloves? Yes, and to keep going and doing the things so you can help yourself. Yes. Um, Mandy, RN living in Yapoon. No one is this area knows enough. Minimal help. Very interested in changing profession. Where should I start? There you go. Mandy, if you would love to I'd love you to contact Anita.
Yes.
Is Yapoon far from Bundaberg? It is, isn't it? It's Rockhampton, Yapoon, isn't it?
It's about a 2.5, 3 hour drive.
Okay. What we should also do, Anita, is get together and put on a like a Chelsea Jean show
Yes,
for
happy
all
to.
of yeah. We'll hire a hall like we've done around the country this year, and we'll go live because there's a lot of things that I can't share and talk about recorded on
Yeah.
social media because you can get in trouble for saying the truth. So there's other things that we can talk about when we're just face to face with the microphone too.
Yeah. And the other interesting thing that I'd love to create a connection with, which you've started with Christina Knox and the scar tissue therapy,
Yes.
is that, a lot of people, they're like in chronic pain, they have a scar. They don't know they have a scar. No one's explained scars. No one's explained fascia. No one has explained how the fascia, the nervous system, and the lymphatic system and the vascular system are all linked together. And if there's a disruption, you're not going to heal properly.
And to add fuel to the fire, they don't even know if they've had mesh added to their body as
Or what
well.
what type of mesh,
What type of mesh?
which
Exactly.
makes a huge difference in even how and if you can treat a person.
Yes.
And then
Yes.
there's the whole conversation around breast implants.
Yes.
Yeah.
Right. So many things. So what I just want everyone to take away from this is like you are so brave to keep on asking why.
Yeah. Never stop asking but why.
Yeah.
Drive everyone crazy with that question until
Yes.
someone can answer it.
Yes. Until you have that moment. Oh,
Yeah.
that's why. Yeah.
Yeah,
And
that's
it's
how I got to where I am because I had to keep asking, but why? But why am
mm,
I still in pain? But why didn't the surgery work? But why are these medications not working? But why am I getting worse? But what
yeah.
has no one looked at? And
And
what
the
has no one looked at? Your lymphatic system.
and the beautiful thing is in our community, if I don't know the answer, like I'm not going to tell you that like, oh, it's lymphatic, oh, it's lymphatic. Like if I don't know an answer, at least we have got amazing practitioners in our boob camp group that I can tag somebody who will know the answer, who will know a natural answer. Or there's some so smart women like coming out of left field. I've never even met them, don't even know their name, and they go, "Da-da-da-da-da." I'm like, holy smokes, how clever are they? Like,
Yeah.
aced, aced that. Like that is like brilliant. So we don't claim to know all the answers, but we might give you a but why that will open up another door of a but why, even.
Yes. Yeah. Yeah. So
Yeah,
for me, the thing is that the day I stop asking, but why is the day I'm going to stop growing.
yeah, yeah. But we do need to have a day where we can just breathe and take it in and give yourself a pat on the back. And that's why I wanted to spotlight you, darling. Okay, to give you a pat on the back for all that you've done to honor yourself and all that you're doing now to honor the men and the women around your community. So, big love to you. Thank you. Um,
Thank you.
Okay. So yeah, take a breath, take a little 5 minutes tonight, even if you just put some magnesium in a foot bath or something, and
Yeah.
just do a little bit of an honor to you.
Thank you.
Okay. Just a couple of questions here. Scar healing would be amazing to hear about. Yep. Okay. So we can do a talk. I can do a talk with Christine.
We could see if the three of us can get together in that.
Let's do that. Let's do
Yeah.
that. Okay, Anita. So your diary is fuller than mine. I think this was the only time you had before Christmas. So
Yeah.
you're right. So let's see what we can do. Ange Quinn, very interesting. I've had calf cramps and tight calves for almost 30 years. Yes, so definitely work up. Have a look in your groin. What's going on in your tummy? Have you massaged your boobs?
Yeah.
See,
What direction are your knees facing?
yes. What directions are you? Which way is it pulling?
Yeah.
Yeah.
If your knees pointing the wrong way, you're compressing the lymphatic vessels in your groin.
See, like smart chick here. Scar healing would be amazing. Yes. Yes, please have a get together in Bundaberg. Let's
Happy to.
organize. Yeah,
Yeah.
let's organize that.
Can do
Um,
that.
Amazing. Okay, darling, thank you so much. Thank you, everybody, for joining live with us on Zoom. We have recorded this. You can watch the recording. Anita, I'll give you a copy of the recording as well. We'll share
Oh,
it on
that'd
our
be good.
YouTube and in Boob Camp and all of our other long form channels.
Yeah.
Ladies out there, if you do have a story to tell, similar, different, like a beautiful story that the rest of our community would love to hear, please reach out to us at hello@chelseajean.com and we'd love to get you on and have a chat too. So big love. Thank you, Anita. Thank you, ladies. Back to work, Anita.
Yes, I'm going. 7:30 tomorrow.
Okay. All right.
All right.
Bye.
Bye.